kind of a pet project I've had over the past year in trying to identify why my local hospital has been what I thought was kind of uniquely under pressure until I got into this role and started doing some work and realizing it's actually a Fraser Health issue across our region. So I'm going to read a couple stats. So Fraser Health contains 40% of the population, which is 2.25 million people, but is only receiving 22% of the budget, of the provincial budget. For comparison, Vancouver Coastal Providence is 24% and 24% of the funding. Island Health is 16% of the population, 14% of the funding. Interior Health is 15% with 13% of the funding, and Northern Health is 5 and 5. So we've got a fairly significant deficit in Fraser Health, where 40% of the population is, but only receiving about half of the funding. Fraser Health is also the fastest growing region in the entire province. Yet, I'm going to read some more stats in relation to that. So the total healthcare dollars spent per person in Vancouver Coastal is just about $5,600 per person. Interior Health, $4,800 per person. Northern Health, just over $5,500 per person. Island Health, just over $5,000 per person. And in Fraser Health, that is just over $3,000 per person. So if we look at the beds per thousand, for reference, the OECD has an average of about 4.2 beds per thousand. Vancouver Coastal is about 2.02. Interior Health is 1.81. Island Health is 2.19. Northern Health 1.89. And Fraser Health is 1.27. Now, for a comparison, we're just above Mexico. Canadian average is 2.6. Now, even with Surrey, Cloverdale coming online and Burnaby, except for now with today's announcement that that's actually been cancelled, if those both come online in about 2030, the number in Fraser Health only increases to 1.32. So we're barely scratching the surface of needs in Fraser Health. So then, even with Fraser Health, within Fraser Health, we have further inequitable spending, in that there's 3 sub-regions within Fraser Health. We have Fraser South, that's at 1.02 beds per thousand, and that's Peace Arch, Delta, Surrey, Langley, and for reference, Delta is the worst in the province with 0.48 beds per thousand. Fraser East is 1.41, which is Mission, Hope, Chilliwack, and Abbotsford. Fraser North is 1.54, which is Burnaby, Eagle Ridge, Royal Columbian, and Maple Ridge. And for reference, Colombia, the country of Colombia, has 1.8 beds. By 2040, Fraser Health, where the bulk of the provincial density is projected, will be at 0.95%, or 0.95 beds. If we don't start vesting and planning now, today's healthcare delivery crisis in Fraser Health will actually look like child's play in 2040. Fraser Health has 0 reproductive cancer surgeons. Langley Memorial has no cardiologists. Surrey has shared maternity wards. Ridge Meadows had 13 maternity diversions in April alone. Peace Arch had 15 maternity diversions in April alone. Mission had 30 ER closures in April alone. A third of Burnaby Hospital are actually patients from Vancouver for which they don't get funding for. The system is collapsing in Fraser Health without adequate funding. So the question through the chair to the minister. It has been known for over a decade that the health authority funding allocation model for this province is broken. Members in Langley were told last year that the funding model was under review. So after 9 years in government, can this minister please indicate when the funding model for health authorities will be corrected and proportionately reflect the reality of population in Fraser Health?
Thank you to the member for the question. And I just want to start off by saying I know there were a lot of statistics that were cited in the member's preamble to the question. And I want to talk a little bit about how the funding model works and the work that we're doing to refresh and change that. And I also want to acknowledge that absolutely Fraser Health, south of the Fraser, is the fastest growing part of British Columbia. And the needs of this population absolutely have to be met. And I think, looking at this government's record, of investing in Surrey and into Fraser Health really does speak for itself in terms of the investments that are required to really catch up to what I would characterize as an underfunded system that was left by a previous government. And when looking at over $3 billion of projects that are going into Fraser Health area around the new hospital in Surrey, a new medical school coming to Surrey, improvements at the Surrey Memorial. I won't list them all off because I know the member understands that, and it's, of course, Fraser Health is bigger than just Surrey. But it is important to note it takes time to realize the benefits from those investments as well. And it is just as important that people who are living there have access to the health care that they need. I want to talk about the way the system works, because it would be inaccurate to characterize or to compare based purely, for example, on funding per person on a per capita system, because that is not the way the health authority funding model is set up. It is a population needs-based model. And that means looking at the demography of an area, so knowing what the age groups are. Are there a lot of children? Are there a lot of elderly? Comparing that between health authorities. Looking at sex, looking at health status, so the complexity of population, looking at some of the social determinants of health and how that impacts the healthcare costs, delivering healthcare to individuals, looking at unmet needs, looking at those populations that have persistent health gaps. That includes Indigenous populations, that includes unhoused individuals, but also looking at some of the racial and cultural differences in healthcare and understanding, for example, that certain chronic diseases are more prevalent in certain populations, being able to account for that in healthcare costs. Looking at the rurality, again, of communities. And then most importantly, because the member, well, not most importantly, but as importantly, because the member talked about, the health authority, the line between Vancouver and Burnaby is a line, and people do move back and forth. And the model does incorporate interregional flows. So it's not just a catchment of exactly who is living inside the borders of a single health authority, but it is the actual catchment area, the way people travel. We know that as the province has developed and grown over time, that a lot of specialized services are cited in Vancouver Coastal Health, and that there are people from all over British Columbia who use those specialized services. So that is taken into account, for example, and may account for some of the differences that the member is speaking about. But as I said, the model is undergoing a refresh right now to help achieve exactly what she is talking about a fair funding model that properly accounts for the healthcare needs of a certain population. We are doing that work directly with the health authorities, so they are partners at the table as the model is being refreshed. And although the work is still in process, it's been a very important focus of the ministry moving forward, so that we are able to work better and more accurately with Treasury Board, for example, in ensuring that the healthcare costs of the region are met. But I'll just wrap up, Honourable Chair, just coming back to some of those initial comments I made around acknowledging the fast growth and the need for investment in Fraser Health, and just express my continued commitment to do just that. Thank you.